How to identify HIV rash in men. Hello everybody, it's Mark Medicals as usual with the latest on HIV cure news, treatment of HIV, how to test for HIV and ways HIV is transmitted. This video covers the following questions, so sit tight and learn. 1. What is HIV rash? 2. When does HIV rash start? 3. Where do HIV skin rashes appear? 4. Is HIV rash itchy or not? 5. How to treat HIV rash. Alright, here we go. 1. What is HIV rash? A body rash is any area on your body with changes in texture and color, sometimes looking like it is irritated or inflamed. It can be bumpy, scaly, swollen, red, itchy, swollen, and painful. Any skin rash occurs due to various reasons like infections, heat, allergens, and immune disorders. The commonest disease that can cause skin rash is dermatitis, which is commonly known as eczema. From this explanation, it is obvious not all skin rashes are due to HIV infection. Almost all of us have had episodes of skin rashes, yet we are HIV negative. Having that said, an HIV rash is what you will suffer from due to an underlying HIV infection. Rash due to HIV infection can be categorized as early HIV rash and AIDS rash. HIV rash is what you will have in early HIV infection, while AIDS rash appears after many years. 2. When does HIV rash start? After exposure, like following unprotected intercourse, your body will recognize HIV after 2 to 4 weeks, and having a body rash are ways your body reacts to the virus. Other seroconversion symptoms include flu-like symptoms, which include fever, enlarged lymph nodes, fatigue, diarrhea, cough, and others. So HIV rash typically appears in the first 1 to 3 months after exposure, and in a large proportion of people, the rash will appear in the first 2 to 4 weeks. 3. Where do HIV skin rashes appear? HIV-related rash in men appears on the stomach, hands, face, arms, and sometimes in the groin. Actually, the rash can appear in any area of your body, though the above-mentioned body parts are the most affected. 4. Is HIV rash itchy or not? As I said before, a body rash appears as a red skin area with red or purple raised bumps depending on your skin color. According to the WebMD website, the rash is usually red, purple, itchy, and painful. So yes, HIV rash is very itchy, but the good thing is that you may not need treatment unless it becomes infected with bacteria. On the other hand, AIDS rash is also itchy, and you must treat it aggressively for it to go away. According to World Health Organization, more than 65% of all people living with HIV or clients experience episodes of HIV rash. If you are not taking any HIV medications, be ready to be in and out of hospital due to infections, including a body rash. Spotted skin is one major physical sign people use to suspect HIV infection. If you develop a skin rash within 1 to 3 months from your last exposure, I highly recommend you go for HIV testing as soon as possible. 5. How to treat HIV rash. Many clients do need not treatment for HIV rash, as it usually disappears in a few weeks without any treatment. On the other hand, AIDS rash is best treated by taking HIV treatment or antiretroviral drugs, antihistamines, and or steroids. Your doctor will be able to tell if your rash is due to the HIV medications you are taking, or due to other causes like allergies, weakened immunity as an opportunistic infection, or other viral and parasitic causes.